Hey, everybody. All right, welcome to our Wellness Wednesday. And I am really pumped about this session today because today's session is going to start, it's really launching a very important topic. And it's going to start a series of sessions that you'll see more in the spring. But first, I'm just glad to say that we work for an amazing university where one of its strategic goals is to support the mental health of its employees and campus community. And that's, you can go to the strategic plan on the university website and you can see that. And so, yay! You don't see that everywhere. So we're very thankful to have that. And so in support of that, that brings us to our topic for today that I'll share in just a few minutes. So we've got a great audience, great virtual audience as well. And virtual, of course, thank you for being here. And if you'll just put RFW as usual in the chat and any questions that you have throughout the presentation, indicate that as well. And then Abby's checking and we will bring that to the attention of the speaker. So, all right, everybody else. You've got something there in front of you that's about self-care and a cute little sticker, so that's yours to take with you in support of mental health. Make sure you sign the sign-in sheet, and I think that's all about the housekeeping. So, next, without any delay, I'm going to introduce our speaker for today. So the importance of mental health is our topic. Dr. Amber Olson is a board-certified family physician dedicated to providing compassionate, patient-centered care to individuals and families throughout every stage of life. She's a graduate of Auburn University, both her undergrad and medical degree, where she developed a deeper appreciation for the holistic principles of osteopathic medicine. Her residency was at UAB location in Huntsville, where she gained extensive experience in comprehensive primary care. And so now she is a family medicine doctor in practice with Medical Associates of the Shoals, the Florence location. She's a member of the American Academy of Family Physicians and committed to building lasting relationships with her patients. What I really, really like about reading about Dr. Olson's background is that she emphasizes preventative care. And, you know, that's what we're all about in wellness. We want to stop it before it ever starts. So, really like that. And her philosophy is treating the whole person, mind, body, and spirit. So that's why I invited her to speak to us today on this very important topic. So please welcome Dr. Amber Olson.
No pressure, goodness gravy. So I like to giggle more than I like to talk serious. I'm also very much a interactive human. So if you have any questions, feel free to ask. If you don't understand something or think I'm crazy, ask that too. Cool? So I'm Dr. Olson. Amber's fine too. I am very honored to be here. I'm excited to be here. I like seeing familiar faces and some people I've never met before, so this is exciting. I'm trying not to stand by this mic. If you can't hear me, just, let me know. So, the importance of mental health. And now I did not practice this like I should have, so let's see. Okay, so no disclosures, nothing. I'm not, okay. So, mental health. When we think about mental health, what do we think about? What, you hear the word mental health. Do you hear medication, therapy, get it together woman? What do you hear? Anxiety, all of the above. Depression, therapist, counselor. Okay, so you're thinking of actual words. What about emotions? What emotions are you feeling when you hear the word mental health? Do you feel fear? Right? Maybe someone that's not really doing anything, is it, friend? Okay, sorry. Do you hear like panic? Right? Do you feel like someone's gonna judge you for it? Right? You never know what people are thinking about you. right?
We don't care.
We don't care.
I do not care.
We do not care. Now, are you the minority in this situation?
Sounds like it.
Probably so, right? You are a very yes. Okay, so I'm gonna keep moving. Just gonna keep moving. Okay, so let's talk about more of the fancy medical terms. I promise this is the only creepy, funky slide you will see. Also, y'all are very, very far away from me, and so I feel very detached. I'm a very person, face-to-face human, so this is kind of intimidating in a way. Okay. So there's three main neurotransmitters we look for in the brain. There's serotonin, norepinephrine, and dopamine. This is why I don't use big words because they are hard to say, right? So this is kind of what we're looking for from the medical side, right? This is the doctor thing, so we can be done with doctor things now. Can we move on? Okay, thanks. Okay. So what do we look for in a human that we're concerned about their mental health, right? So not only are we thinking about ourselves, we're thinking about our family members, our students, our fellow coworkers, people that are around us, right? We want to make sure that we're not only thinking about ourselves, but we're also thinking about others, because sometimes we just don't want to say it, right? We need to be friends to others and kind of make sure that everything is going in the right direction, right? Okay. So when you're looking for concerning symptoms in ourselves or others, you're looking for these main things. So being withdrawn, avoiding people, trying not to interact with certain situations, saying, no, I'm not doing that. Or on the other side of it, life of the party, whoop, whoop, right? Like they've never done anything. All of a sudden they are doing all of the things, right? And now they have no money, right? Those are the people you're looking for as well, right? But most importantly is the one right smack dab in the middle is you got a bad feeling, right? So God gives us this wonderful sensation as females that we have this like gut feeling that everything is just something is off. Our kids are sick, we don't feel well, our husband's being funky, what is going on, right? That's the biggest thing that you want to reach for is trusting your gut, okay? Because mental health at the end of the day is all about our feelings and how we're doing. How's our life going? But most importantly, making sure that we're okay. Okay? Okay. So, this is the words that we started off with, right? What are those weird diagnoses that we hear all the time? Adjustment disorder. So this one is probably the shortest lived. The most common in what you're going to see in your students. It's called adjustment disorder because it's in that adjustment period. It's most common for college freshmen and military recruits. They're taken out of their big baby cocoon and they get pushed into this new miraculous world that is terrifying and or adventurous, right? They've never marched 8 miles before in boots. That's terrifying. People are now yelling at me, ah, right? It's a complete shock to their nervous system. Same thing with college. Now they have options for alcohol. Y'all know it's true. Okay, so you can have dissociation, right? So you literally are watching yourself in a situation, right? You've never kind of been there before, and you can actually like watch yourself go through things, okay? You have crying spells. It's a big, major life change. I went through this when I had my first kid. You've had a baby, you know you don't sleep. It's not lack of sleep, it's adjustment disorder. All right? Something to think about. So what happens? Time gets better, it can keep moving. Yes, ma'am.
Do you think that that is worthy of like also Better Living Through Chemistry and Prozac or something like that? Or is that temporary enough that giving it time and therapy will do the trick?
Temporary enough that a time of therapy will do the trick. If it's lasting longer than 6 months and it's not a detriment to their life, current situation, like they're not like suicidal or any of those kind of things, let it wait out. Let it ride. See how it gets better. Any other questions? All right, depression. So this is very, very, very common. So I'm also putting the little people up for who you should think about. This is Eeyore. My millennials, I think, are the only ones that may not know who this is. But depression, this is, so sticky caps, can y'all see through me? In my visuals, can y'all see through me? See the PowerPoint? Okay. So sticky caps is kind of like our medical terminology for what we're looking for. It's a list of different symptoms and diagnoses that we're looking for. So those are the kind of basic things. And medical people love mnemonics for no reason, and they're very difficult to remember half the time, but we still do them consistently. So that's what you're looking for in a depression. Now, I feel like depression is the most commonly thing thought of, and it's the most common thing that we kind of point to everything, right? But the difference between men or women are very, very, very common, okay? And so if you think about kind of that testosterone, so we're looking at, as men, I mean testosterone, women as mostly estrogen, right? So that testosterone is going to cause aggression, anger. They're going to turn inward and they're going to try to do more substances, right? So you have an alcoholic, they are depressed 9 times out of 10, okay? Because alcohol in Xanax is the same thing to your brain. A shot of liquor actually can do the same thing as 0.5 milligrams of Xanax. Give me a minute. No, you cannot go into an MRI drunk.
But it's why it helps you sleep on a plane.
It does. I'm telling you, it's tough, man. Same thing, right? So, they're going to go more towards the substances to remove themselves from the situation, and they're going to be very risky. They're not going to be suicidal, they're going to be risky. So they're going to drive really fast, they're going to turn really fast, hit stuff, right? That's risky depression behavior. Now, that is different from teenager behavior. Y'all have boys, you know this. Okay. And then women. Women are going to be the stereotypical depressed human. They're going to have abdominal pain, they're going to have crying. They have a lot of gut symptoms. Why? Because there's a serotonin response in your gut. So, research has come out in the last year, well actually I'm lying, probably like 2 or 3 years now that I'm thinking about it, that actually shows that depression from like an IBS standpoint, so IBS is actually just a form of depression in your gut, and it's because you have a lack of serotonin in the gut muscle. Alright, so we put you on a serotonin medicine, constipation goes away. Diarrhea goes away, right? Craziness. I've tried it a couple times. It works about 50% of the time. Because some people just eat bad, and I can't help that with a depression medicine. All right. Next up is anxiety. We all know Piglet. Right? So we are looking at females are 2 times more likely friends. We all knew that going in, right? So restlessness, feeling on edge, can't concentrate, irritability. Some might say pissed off, or I'm trying to use really good words, but anyways, muscle tension, sleep issues. I have a lot of people that come in and all they have is palpitations, heart beating out of their chest. I don't understand what's happening. I walk into this room, I go to walk into the building of my office and my heart starts beating really fast. They hate their job. So all they need to do is get a new job and it will go away. I'm not pointing fingers here, friends. We're just talking about options. So the biggest thing that I'm trying to point out to you, I'm not sure if you've noticed, is that a lot of times mental health symptoms are not what you would typically look for, right? We're looking for the weird stuff, the stuff that doesn't make any sense, the stuff that doesn't go with what you would typically think. Because when you have someone that's not doing well, they may not present as being like, oh, I'm sitting in the corner crying. Because that's what we think they're supposed to do, right? But that's not real. A lot of times they just aren't doing what they normally do. And they're not depressed, something's wrong. And we can't figure out what's happening. Maybe, like I had a patient that came in, and I don't like patient stuff, just let me know, but I had a patient that came in who is crying, boo-hoo crying, like she's having very, very, very depressive symptoms. And she's like, I just don't understand, I'm losing weight, which I know it's not a problem, but for her it was. So we were losing weight, she wasn't eating well, she was having a horrible, very bad days, didn't understand what was happening. So I'm starting talking to her, I'm getting information from her, and she's just like, so what's been going on? She said, well, my grandpa passed away, and I had COVID and I couldn't tell him about it. So you're grieving. This is grief, right? So it's not always exactly what you think is going on. Conversation, talking to people, making sure that you have that rapport with people is very important to figure out what is actually wrong with them. Yeah, I like the response. Yeah. Love it. Panic disorder. Freaking out, right? So everyone thinks it is. So pounding heart, dizziness, you feel like you're going crazy, like, I'm in your way, aren't I? People are just having like difficulty understanding how to do things. I had one patient that every time she picked up her phone at work, she would go into like a panic attack because she was so afraid of people yelling at her, right? That kind of thing. That is, serious panic. And there's a difference between anxiety and panic disorder. So anxiety is whenever you're nervous all the time. There's not a situation that it doesn't get any better. Panic disorder is a specific instance, right? You are having a panic attack. You are having something that's making you panic. This is a specific situation. You don't use benzos or like Xanax and Klonopin for anxiety. You use it for panic. That makes sense? Because you want to use it for a specific instance. All right, treatment. So I was gonna bring some PHQ-9s, but I walked out the door super excited because I was on time, and then I forgot them. But PHQ-9 is a testing that we can do. It's online everywhere and completely free. And basically, it tells us your risk, or kind of it puts a number on how you're feeling, right? Because we cannot quantitatively, and that's a college word. You're welcome. Quantitatively assess someone's risk. Because I'm not in your brain, right? So this is a way for us to quantitatively figure it out. It's also data, which college people love data, right? Professors, you're welcome. So I can see the progression over time of how they're doing. So if I do a PHQ-9, it's 20. That would be bad, right? That's high, okay? So if I'm going to give them medication or some kind of therapy, stuff like that, they come back, it's at a 3, then we're good, right? They come back in, it's 19, didn't do jack, right? So that's how we kind of look at it. Other medications, so this is kind of where those neurotransmitters come in. So you can attack the serotonin, you can attack the neuroepinephrine, or you can track the dopamine, or you can attack a couple of the different options, right? This is obviously not a medical lecture, so I'm not going to go into the details of these medicines because that's boring. So we're going to keep moving, but there's plenty of options out there. The other big thing about medications, just because you didn't like one doesn't mean that they all suck. We just got to try different ones out. The hardest part about mental health medication specifically is, it takes time to get into your system. It takes time to adapt to different situations and figure out which ones are golden ticket. Sometimes it happens where the first one is the best. Sometimes it's not. So, bipolar disorder. This one has been a really hot topic. This on Twitter. Everyone thinks they have bipolar on the, not Twitter, what is that called? TikTok, right? Yeah. Face all the things, whatever books you got. So everyone thinks they have bipolar disorder. So there's actually 2 different types of bipolar disorder, okay? Who knew that there was 2 different types? Anybody? Yeah, a couple people, right? So bipolar 1 is what you think of whenever you hear bipolar disorder, right? It's the people that get arrested. It's the people that can't hold a job, spending all their money, getting pregnant, right? Those are the people that you think about with bipolar. But bipolar in any situation is not bad. It does not make them a bad person. I'm just reiterating these things. Right? It makes them unmedicated, right? Once you medicate a type 1 bipolar disorder, they become a normal human. Regular emotions, regular judgment, capacity is completely reasonable, all of those things, right? Now, bipolar 2 is whenever you take a medicine for like regular depression and you're actually that much farther down, right? So those are the kids that you're going to see, or the people that you're going to see that are very young, right? So they have bangs in their hair, right? They're very, no, not you. They're covered, right? They wear black all the time. They wear their sweatshirt indoors. I'm not talking about you. They close up on themselves, right? And they just kind of like walk through life very gently. Because they're more than depressed. They're bipolar depressed. Does that make sense? Right? Because those are the people that need medication in order to get out of it. It's different. Okay? Okay, ADHD. TikTok telling you you're ADHD too. I have plenty of patients keep telling me I'm neurodivergent, and I don't know why. So lack of focus, inability to multitask. They cannot get anything accomplished. I'm trying not to use bad words. Tigger, anyone knows Tigger? You have bipolar, or ADHD, sorry. So, I think of her, and honestly, I think she's more bipolar than she is. It's a great day today. So there's plenty of different medications that you can do. You can do stimulants, you can do non-stimulants, again, boring. You can also do lifestyle modifications. So when people drink a lot of coffee in order to stay focused, and if they don't have coffee, they can't stay focused, they should be established and seen if they have ADHD. If they do not have coffee, they cannot get anything done. You should be done. Okay? If you just increase your exercise, right? If you have ever been told to just go run it off before you go to school, that is typically a sign that you have some semblance of ADHD. So that's the original treatment for ADHD back in the day, was to run it off, right? Then you can also do mindful tricks, like trying to use all these fancy planners they keep putting out there on the web, right, on the YouTubes and everything, trying to figure out which planner is the perfect planner to use for ADHD. Find out it's on your phone, friends. Good stuff. You turn off your phones. You reduce the distraction is probably the best thing you can do. If there's not a blinking red light in your periph, then there's nothing else to look at. Right? Okay. Alright, so best question I have is, can I fix this without medications? 110% you can fix this without medications. And I actually prefer that. So like she was saying, I am somebody who likes to treat the entire human, like finding the reason for the problem to then figure out what's going on. The number of things that are not depression or anxiety or all those kind of things, like could it be a heart attack? Yes. Could it be, a deficiency of something? Yes. Getting to the root of the problem is my number one fix. That's what I like to do. It's kind of fun to figure it out when other people don't find it. I like to go find it because it's a puzzle. And a lot of times we look for ways to fix things, not preventively, but actually we have the symptoms and now we're going to fix it, right? We don't want medications, we're going to do it. So there's been research that's come out in the last 2 years, fun fact, that shows that comfort foods actually increase depression. So what happens? So these wonderful little yummy things cross our blood-brain barrier and reduce our serotonin.
Wait.
Yes.
They're different for everybody. How is that possible?
Your body reacts to everything differently. There's a genetic abnormality there's some different genetics, I'm assuming, right? And so different medications affect different people, so different people have different ways of breaking down those things. What question? Make them easy. Right.
Maybe a question, I'm not sure, playing on what you said, but, so comfort food, I guess maybe if you have some other things going on, like body's not, you may feel good while you're eating the food, but then you feel
Worse afterwards.
feel worse afterwards, or if you don't have the other.
Yeah. So a lot of it comes back down to the actual molecule, the large carbohydrate, the actual molecule coming from like fried foods or I think it's more from like fried carbohydrates, like French fries is what I'm talking about. We're using these words. French fries, right? So French fries and things that are similar, like $10. I don't know what good that, right? Things that you are craving whenever you're sad, not so like ice cream or anything like that, but like actual carbohydrates, crosses your blood-brain barrier and reduces your serotonin levels within your brain. And so if you already have a serotonin deficiency, the deficiency gets worse.
So maybe it's some other way than guilt about eating.
100%, yes. It's not going to be exactly like the guilt. It's just going to be that you're more in depression. But remember, guilt is a sign of depression. It's the G in Signios. Nine? Weird, right? Medical. It's like a glimpse into God's world. Like, why do you do these things? The other thing is avoiding temptation, right? Don't compare yourselves to others. Okay? I stopped going on Facebook when I was in medical school because everybody else was already married and they had kids and they had a cute little house and I'm over here in my 20s just chilling with my books, right? So it was you remove the temptation of having those comparisons, then it helps, right? So it's kind of more preventative but also treatment. So like if you're like, oh, I'm sad, I don't have a man or whatever, whatever it is, then you remove yourself from that situation so that you don't keep reminding yourself constantly that. Okay, what about weight, right? I'm mad that I'm overweight, right? So if you're mad you're overweight and get clothes that fit, so you don't constantly remind yourself that you're overweight. Hence the shoes, All right. Other lifestyle modifications. Exercise is always really good, right? Yoga is great. It centers you. It's also boring. So if you want to do something interesting, Pilates is my go-to. Nutrition is important. Meditation, worship, praying is always good. Going outside. Okay? If you are sad or tired, go outside. You need vitamin D anyway. Y'all work in buildings all day. Go outside. Okay? Good stuff. Support groups. Don't stay outside by yourself, or don't be by yourself. Journal, therapy, girl talk is always good. Alcohol is not the best. I feel like I'm in the way. Like I don't know how to stand here and not be in the way. So what do? Right? I like to pray. I tell Jesus every day, sir, you got me this far, you better not drop me now. We ain't doing this. All through medical school, I kept telling him that he better keep me getting it together because he's got me in this mess and I'm only doing this for him. So if he doesn't keep me here, I'm going to be mad. Right? Because, okay. I read a lot. I spend time with my kids. A big source of my some of my anxiety and stuff is my husband or like my family. And like my kids, right? So like if I'm like, oh my gosh, why are you doing this 3-year-old? I just walk away, right? I leave the situation. And sometimes that helps to kind of avoid having a backlash on my end and then making everything worse. So that's how I manage my mental health. Still working on it. All right, so when do we look for help, right? When do we jump in head first 2 feet, or when do we toggle into the small water, right? So immediately, you need help whenever you have suicidal ideations, homicidal ideations. If you want to hurt somebody, yourself or others, call somebody, please. Or come talk to me, I got you. And then audio visual hallucinations. So if you're seeing something that's not there, or you're hearing something that's not there, you should tell someone, okay? And then soon, so maybe you should tell somebody eventually, maybe in the next couple weeks or so, get that process, that ball rolling, would be, excuse me, I'm so sorry, if you're unable to function, if your grades are suffering, which I know you don't have grades, but like if you're, checking the time, we're good, if you're having any sort of like all your people are mad at you, there may be a common denominator, and maybe something that you need to fix, right? Right? So when my kids are mad at me, my husband's mad at me, and my mom, I'm like, wait a second, introspective moment, right? Maybe it's me, right? Okay. All right, where to find help? Doctors are helpful. I know doctors suck. I understand. They don't listen. They're annoying. They're wearing these stupid white coats that don't make any sense. They're all, like, white coats are just dirty, y'all. It's nasty. Like, unless you're going to wash it every day, like, keep it at home, right? And then pastor, spiritual leader, a mentor, finding someone to talk to, or being someone for them to talk to, right? Because at the end of the day, just being like, are you okay, can make a world of difference. So there's actually been a research study, which I think is very interesting. I'm not sure how they got that data. They were doing, I think they were doing like questionnaires for like teenagers and stuff. And so they said a lot of times teenagers who are suicidal or kind of in that box of no return, basically, right? They would have said something or they would have done something differently if someone would have asked them. But because no one asked them, they didn't make a difference. And I still want to know how they got that research. But that's the research that I found. Okay. So, TikTok told you something else. But the priority is making sure that we're looking at the whole situation, not just a single situation, right? Get off of TikTok. You know we still watch it, right? Cat videos, great. Medical advice, no. I had the number of times I have patients that come in and they bring their phone. Can you watch this? Sure. That's not real. Right? The number is sheer glory, the number of times. They're like, hey, can you give me a cardiac panel? I was like, what's a cardiac panel? They're like, I don't know, TikTok told me to get one, so I want to make sure that I don't have a heart attack. Not helpful, right? So making sure that your data is good. Now we're going into the AI world, y'all. I'm terrified. I'll be honest with you. AI can write papers. Yes. I'm just gonna, I know y'all know. There goes the anxiety, you see it? Right? So, it's terrifying. We got AI to write out our whole mortgage to see how, like, what would be the better situation. God, that was terrifying. Computers. Ugh. Okay. All right. So I am open for questions to see where we are. I did pretty good, I think. 30 minutes. Ah. Woo. I'm glad I didn't have my watch on me. I had like 800 messages.
Well, Mr. Craig's gonna start us off.
I'm ready. I didn't see you. Sorry. I
That's a
had my
lot of
butt
good
to the whole time.
information.
Yeah, it's very good.
Is there anything nutritional wise, I've read about omega-3 fatty acids and depression. Is it tryptophan, that's an amino acid for serotonin, and we don't get enough protein or something?
Yes. So okay. So tryptophan is that fun thing that's in turkey that makes everybody go to sleep. It's not the tryptophan, man. It's the carbs. It's the potatoes and the mac and cheese and the pie. So tryptophan is actually something that is naturally occurring in our body. It's an amino acid, like you said. It comes from meat. And so I would not necessarily add that on extra. I would just eat meat. And protein's a beautiful way to get that. The studies I've read don't make any sense in regards to tryptophan kind of doing anything. There's nothing like seriously like recommended for that quite yet. And then you said omega-3 fatty acids,
Marine
right?
source, not the plant, DHA, EPA.
Yeah, absolutely. Marie's good job, friend. That's me doing research. You've gotten past the AI, haven't you?
I stay away from that.
No, I had a patient come up to me one time and they're like, I promise, I do my research correctly. I get past the AI before I start looking. And I was like, thank you. Yes, so marine source omega-3 fatty acids helps reduce general medical conditions, basically all of them. And so it helps with kind of diabetes is what I'm trying to say. Diabetes, heart failure, high blood pressure, things like that. And so that overall look at your health helps with everything else more in life.
Thank you.
Questions do we have? Yes.
Yes, ma'am. Person I've never met before.
Full disclosure, I go to see Dr. Olson and she knows my little big book. And I'm like, okay, where do you want to start? She says, get out your book. And it's like, okay. But, you know, I'm looking around this room and we, very similar ages, kind of we are in a university setting, we are in buildings. So what would you say would be our biggest challenge? You know, we do have obligations. So as women of certain ages, you know, is there something more we can do? I see a lot of us, we walk around campus, we do take advantage of the walkability of the space, but, you know, to me it seems alarmingly low when you said depression is only in 2% of people over 12.
8%.
That's still alarmingly low.
Yes. But remember that is the textbook. It's not the reality, right? And a lot of times mental health in itself, there's not a lot of depression in real life, right? The people that I see that have depression are the ones that are actually there, right? The grand scheme of humans don't show up, and so they can't be in the percentages because they're not even there, right? So, honest to Betsy, I think the biggest issue that y'all face is no offense for people in the thing, is the computers, right? So what you're doing is you're separating yourself from others, number one. You're decreasing your socialization. And then you're prioritizing yourself in one focus and there's nothing else around you. So you're increasing your eye strain, right? You are increasing your sedentary lifestyle, which is causing you to either, gain weight or eat or do different things like that, right? You're not walking because you're not going places to places. And so you're like COVID screwed everything. And we all know that, right? And so the biggest reason why that happened is because the socialization went from amazing to nothing, right? And so the best thing that y'all can do is just get off of the computer. And I think that's the biggest thing, like the phones, the computers, not to be like a boomer in the whole situation, but technology is becoming our downfall. I'm a huge believer in the truth of quality.
How detrimental then is social media as a part of that? How detrimental is social media? If you go home and it's big screen and you're looking at little screen, you're at work, you're looking at medium screen. So where does social media fall in on the grand scheme? Would you say don't do it at all? Is there a happy medium?
I think there's a happy medium, right? If you are looking to find out information about a person, trying to reconnect, I think that's a beautiful way to do it. I mean, we used to send letters and things. We can't do that anymore because the mail takes forever, right? So I would probably say if you're doing it to converse with someone, to kind of have that conversation also like, or what I usually do, because every so often I get a wild hair on YouTube, I'll set a timer on my watch and like say, okay, I'm going to watch random videos about cats for 10 minutes, right? Because you know when that little thing is, another one pops up, like, oh, that's cute too, right? Well, this is what happened, right? So set a time on your watch, and then I'm all into that right now. My kid's worried, and she's very much, but did you set a timer? No, and this hasn't been a minute. So we've been on that train, but like set a timer on your watch or some kind of timer on Alexa or whatever, and then that way you can kind of have that solidified end. But I think social media is a beautiful thing because it's opening up our community as like a whole. It's getting small brands out there. It's getting information out there in good ways and bad ways, right? So keeping that balance, I think, is the most important.
I just kind of feel like depression is one of those diagnoses that's just thrown out there so, like narcissism is now. So the 8% you're talking about are actually diagnosable according to DSM.
DSM-4, so it's old research. I'm sorry, I forgot
Or
about
whatever.
No, but it's old research. It's from the DSM-4 is what I have the research from. I couldn't
Okay.
find any research on that. Because it's only been around for 5 years. I don't know where the research is at.
Yeah. So also, just kind of following that route, I just kind of think like with social media, I personally feel like it depends on the content you're consuming.
Correct. Right, and that's
And
what
what your-
the balance, correct?
Right, what your motivation is for the content that you're searching for, like,
Mhm.
maybe you're searching in the wrong space for what you actually need.
I'm just saying the book GP is where it's at. He cuts off all this weird stuff off of the cow's feet. Y'all know what I'm talking about, right? If you've never been there, it's nothing to do like you're doing work. I'm just saying. It's very distracting. I'm sorry.
Well, I was just gonna add to that, I only limit myself to like Facebook and because I have lots of relatives that I keep up with, but also I've noticed that on my feed, if I put things that I'm really, really interested in, like the plant people are so kind. So if you want some kind things in your feed, go to the plant people and the artists.
Yeah.
And suddenly your feed, like the news goes less and less. But also there's a book out, for anybody who's read it, I'm sorry, you already know about this, but The Anxious Generation. It is an excellent book that talks a lot about the impact of social media and cell phones or smartphones, and especially with adolescents and depression and that kind of thing. So I highly recommend it. I've had students read it before. They're adult students, graduate students, being like, I had no idea. So, and the other thing I just wanted to add is that for me, one thing I rarely see on these sorts of lists is creativity. And as human beings, we're meant to be creative. So some of us, that might be knitting. I hate knitting. Some of us, that might be doodling on a pad of paper every day. Whatever it is, some people might be more creative and do a web page. I don't know. But just something creative that really speaks to you seems to really help a lot of people. And when COVID happened, I noticed with my patients, a lot of them gave up the things they liked that helped their mental health like
Absolutely, yeah.
that. So one of the questions I started incorporating into my visits with patients was, and how are you taking care of yourself mentally, spiritually, physically? Physically, they could usually answer it,
Doing that.
but and I would say, for some people, when you're talking about spiritually, like that means religion, but I'm talking more than religion. And I'm amazed at how many people say, I used to do such and such, and I gave it up. So just getting them to think about that.
That's a really good idea. I love that.
And I guess you made me think, and we're forgetting about the algorithm. So if you're going through a bad period in your life that's just short and temporary, and
Yeah.
you're searching
Yeah.
these things,
Yeah. It keeps you.
you're gonna continue receiving that. I mean, eventually even if you get over your little spell, you
Adjust
may
it
still
maybe,
be,
yeah.
you're still maybe receiving that that's
Coming at you.
unconscious. You don't even realize it.
Absolutely, 100%. I agree. You need a question? You
got doctors that thankfully you're looking at the holistic approach and let's look at lifestyle first and those kind of things, but you do have doctors that are little field pushers. But at what point do you need medication to support your mental health versus, maybe you just need some lifestyle changes?
Absolutely. So it all kind of goes back to that when to seek help kind of conversation. Like if you are in a state of yikes, right? Like everything is falling down, everything is kind of having an issue. The wait and watch method's already gone and passed at this point, right? So kind of getting that medication in the system to kind of calm everything down so that they can do lifestyle modifications to maintain it is very helpful. And normally it's a conversation. Like I'm not the kind of person that just kind of jumps in and says, oh, we're gonna do this. Like I like having a conversation because autonomy is a beautiful thing, right? It helps us be one with our medicine. It helps us be one with our health. Because at the end of the day, it's your body, right? You know your body. You know how your body, like I know this is me, right? So what I usually do is I have them kind of have a conversation about what is currently happening, right? Do they even think it's anxiety? Do they think it's depression? Do they, are they willing to admit that it's a mental health condition that's causing them to be in this way? So I have a lot of people that will seek out multiple types of doctors because they can't understand that their whole situation is anxiety. They don't want it to be, right? And so I'm like, okay, well, have we considered this? Have we considered this? Yes. Everything is coming back, no. They keep telling me it's fibromyalgia. And I'm like, okay, maybe it is fibromyalgia. But fibromyalgia has a element, so in its core, fibromyalgia is actually a form of PTSD, where your body cannot, like your brain cannot comprehend the difference between mental anguish and physical pain, right? So, you fix the mental anguish, the physical pain goes away, right? And so the first thing to do is see if they can understand that concept. Like, are you okay with it being your mental health that's the problem, right? And in those situations, if it's not, then we do all the lifestyle modifications that we can. We talk about all the options in the book. Let's do this, let's do this, let's do this. And I have them come back in 4 weeks and see how we did, okay? So they come back, it's not better. Nothing has changed because we're not treating the problem, right? We're not getting to the root of it. We need therapy, or we need this. Maybe we need some counseling. Maybe we need something, specific. Maybe we're bipolar and we just need medication because a lot of times bipolar cannot be fixed by lifestyle modifications, right? Because it's a absolute chemical deficiency, right? And so in those kind of situations, we figure out what is the best case from that perspective, and we keep moving. Okay, that's also why I do those tests, like the PHQ-9 and the GAD-7. So PHQ-9 is for depression, GAD-7 is for anxiety, right? And so I'm using those two tests to kind of figure out to give them a number, because those questions are specific to specific things that you don't think about as being depression, right? Or you don't think about as being anxiety, right? And so you just say, okay, there's a 3 on that one, or there's a 0 for that one, and then you add it up and you go by the score, and you see what's going on. So sometimes putting that in front of them is kind of like putting in front of them their cholesterol numbers. Let's talk about those, right? So you're kind of similar in that way, but you're showing them their mental health in a quantitative way so that they can understand it, right? So that's the number one, is getting over that hump. And then after that, kind of seeing like where they're at. Because some people walk in, they want medicine. It's not me that's pushing their medicine, it's they want medicine, right? And I'm like, okay, let's try the medicine. Have you tried this? No, I want medicine. Okay, let's try medicine. But have you tried this? No. Okay, let's try this. Medicine it is, right? Right? Same with weight loss medicine. Anyways, that's a whole other topic. Whoa, another day. Woo! That's a whole other conversation. But anyways, so in that way, like I start medicine, and then we try to come off of that medicine every time we come in. We talk about what else can we do.
And the test, the survey or questionnaire type test that you mentioned, that's the only way to quantitatively measure mental health deficiencies. Like, there's not a blood test or anything for serotonin levels or
right?
Blood from where?
You can't get the blood from the brain. You can't go in the brain and get the blood out of there, right? And so the question is, are the research is not quite there that I've been able to find that shows that the same serotonin levels are in the brain as they are in the regular blood, right? And so if you're looking for serotonin levels, are they in the cells? They're more in the cells than they are in the blood, and it's hard to find the serotonin in the blood. Now, someone has asked me to order serotonin levels in the blood, and I was like, specialist. They said it's real. It's not a thing. Insurance won't cover it.
Yeah.
When in doubt, insurance will not cover. Yes.
I was telling you questions.
That's the whole.
Oh, you're fine. I'm good.
When you're talking, I love your question, Alan. I don't know, your, serotonin levels don't mean one or different.
Mhm.
So you can't test for that to see how much or which one is, so you're prescribing medication. How do you determine what medication?
Great
is
question.
or something else?
Great question. Symptoms, right? So, I probably can't use bad words. So, I have a medication that I like to call the Give-A-Care medicine, but you insert the bad word you want to there. And it's called Wellbutrin, right? And so that is mainly dopamine. So if people come in, they're like, I don't want to do anything. I just want to sit on my couch. I don't want to do anything. Right? That kind of stuff is a dopamine person, right? They need dopamine. They need something that's kind of like grabbing them. Or the people who are constantly scrolling or constantly watching TV. Couch potatoes is another word for it. Those are the people that need dopamine because they need that constant buzz. Right? So if you increase their dopamine, they'll get up and do something is what the theory is, right? Then you have the people who are constantly down, right? Or just everybody else. For the most part, the anxious humans, the depressed humans, outside of bipolar and ADHD, you treat with serotonin. So it's kind of like dermatology. So how do you do dermatology? If it's wet, you dry it. If it's dry, you wet it. If you don't know what it is, you put a steroid on it. And then if you have that steroid didn't work, antifungal, right? Okay. So that's dermatology. Same thing with medication. Y'all, we're just shooting things out. We don't really know what we're talking about. We're dealing with God's creatures, right? So we're just kind of, meh. So we usually throw out a serotonin medicine, right? Just see what happens, right? So SSRI, right, is going to be our number one. So I'm always going to start with serotonin medicine, unless they go into mania and then they're bipolar. So then I go into the antipsychotics, right? If I start with that medication and they're like, it was helpful, but I still have my pain hasn't gotten better, I'll do an SNRI, because norepinephrine, which is the SN part, the norepinephrine helps with the pain, right? So if you come in and you have arthritis, joint pain, and you have depression, I'm going to put you on an SNRI, like duloxetine or like Cymbalta, which is the same medicine, venlafaxine or Effexor, right? Those medications, because those are going to attack all of those things, right? I'm looking at the whole person, right? So if you come in with headaches, difficulty sleeping, inability, like you have a lot of anxiety or depression, I'm going to put you on amitriptyline because it is a headache prevention. It puts you to sleep and it helps with your anxiety during the day. I'm going to kill as many birds as I can with that one stone, right? So you're looking at the whole situation, not just one thing. That make sense? Cool. Questions from this side of the room? I keep looking over here because they keep raising their hands. Okay.
All right, excellent. And this is a little something for you, we appreciate you helping UNA to alert, so thank you so much, and that's a little of you. Cover, yeah.
Yes.
Yeah, so, thank you again. Natalie's passing out a survey, so, in the area that says additional topics, let's, just in keeping with this overall subject of mental health, and that will help me, my team, we will be in a planning session next Wednesday, because there's no Wellness Wednesday. And so put those topics down that relate to mental health.
and, we'll do our best. And even if it's not in the spring, it'll be for the fall or, whatever. And if you know people in the community or on campus, that can speak to that topic, please do let us know, because that's sometimes the challenge we run into. So, let me see, what else? And we have, upgraded our YouTube channel. These guys over here, they're from sport management, and my colleague, Mr. John Allen is here, and his GA, Braden Rogers. And so they have really elevated our game with our YouTube channel. So this will be out, or this is like streaming live, right? Okay, it's streaming live, which means, like if somebody wanted to go out in the afternoon. So at 4 o'clock this afternoon, for example, if one of your colleagues missed this, or if you want to pass this on to your friends and loved ones, hey, just send them the link to the Healthy UNA channel, and it's gorgeous, like, and it just really looks good. So, thank you all for being here. One more housekeeping thing. So next week, no Wellness Wednesday, but following that, we are just very fortunate to have Miss Lee Stanfield, who is going to be leading us in a nice craft right before the holidays. It's going to be really nice. It's going to be in Collier Library, and this kind of, it supports our mental health with some stress reduction, a few minutes away from the office, and it's all about ornaments. That's all I'll tell you. So you'll see, it's not campus groups already. Register on campus groups. All right, thank you